I'm Samira, and today we are going to be teaching you guys about COVID-19. This is by Jenny, Blessing, Samira, and Lucy. We are going to be a student nurse today. So the teaching process will be towards an 8-year-old child named Sarah and her mom. Blessing, would you like to proceed?
Hello, my name is Blessing, and I'm going to introduce what COVID-19 is to you. COVID-19 is coronavirus. It's a coronavirus disease. It was identified in 2019 and has caused a pandemic of respiratory illness. It's a very infectious disease. Now I'm going to talk about how COVID-19 can be assessed. And here are some reasons why you should get tested in the first place. You should get tested after exposure to a known contact of COVID-19. Before and after you travel, you should get tested for school and work purpose. And the tests can be assessed in either through the nose. The test samples can be gotten from the nose or the mouth. So we have the rapid test. The rapid test, this can be done at home and you can get the results in few minutes. The sample is usually obtained from the nose. And there's also laboratory test. This sample can be taken from the mouth and also the nose. But the result takes 1 to 3 days to be out. It takes 1 to 3 days. This is the PCR test. That's the common one. So, Lucy, would you like to give us more information on nursing intervention and symptoms?
My name is Lucy. I'm going to be telling you and Sarah about symptoms of COVID-19 nursing parental intervention. The symptoms can be fever, cough, tiredness, loss of taste, smell, difficulty breathing, and chest pains. My first type of advice is explaining to Sarah what COVID-19 and what danger can occur from being infected with COVID-19. Having your child vaccinated will also be helpful with serious illness. Second, I suggest explaining the importance of social distancing by using references such as a hockey stick or any object around the house that will help her visualize how far 2 meters is. Also, explain the importance of social distance in crowded areas such as shopping malls or public swimming pools. Another important step is to show proper hand hygiene for your child for 20 seconds by singing the alphabet song. Also, proper demonstrations such as wearing a mask, sneezing, coughing within her left elbow, and avoid touching her face with her hand. Nose, throat, eye to limit germ as well. If your child is diagnosed with COVID-19, have your child isolate and retest for COVID until the symptoms have disappeared. Have your child take Tylenol if fever, pain appear. If your child develops serious symptoms such as trouble breathing, please visit the ER immediately. These are the common nursing intervention for patients with COVID-19 in our hospital. We will provide some information to a patient about their diet, proper hand hygiene, increasing fluid intake, resting, practicing deep breathing, increasing mobility, and exercising. For infection control, we will also wear appropriate PPE such as gown, mask, and gloves. Samira, would you like to tell Sarah and her mom how they will know when the COVID gets better and how long it usually lasts?
Absolutely. The symptom can last between 6 to 14 days. The first 3 days, the symptoms are the worst. And after that, they get better. Jenny, can you tell us if this is curable and if we need the time for it to heal?
Yes. Okay. Hi, Sarah. Sarah and Mom. I'm going to be explaining whether COVID is curable or not. Okay, so patients who develop the condition with minor symptoms generally take up to 2 weeks to recover, but with severe symptoms, it may even last up to 6 weeks or even longer. This varies between individuals because I actually had a friend who caught COVID in 2021, and after recovering, he still had the symptom of no smell for 3 months afterwards. Okay, so how this works is the immune system is a complex network of cells, tissues, and organs that work together to keep the body healthy, and antibodies are proteins produced by your immune system to aid in the battle against infection to keep your body from becoming ill. And therefore, your immune system actually determines how well your body can fight against the disease. Okay, now I'm going to be speaking about if you can contract it again. In brief, yes, you can. So, the virus that causes COVID-19 is constantly changing, resulting in new variations, which raises the chance of reinfection. So according to a study, the time between reinfections ranged from 90 to 650 days, with the average being 343 days, or nearly a year. So how it works is B cells and antibodies are components of the adaptive immune system, which is the branch of the immune system that targets particular diseases. The innate immune system, on the other hand, offers a broad defense against infection. Helper T cells, a kind of T cell, stimulate B cells to make antibodies, and killer T cells, on the other hand, assault cells that have already been infected by a disease. So after you have already contracted COVID, I guess it kind of makes it harder to get it again because of the fact that you already had it. It's familiar, basically, and it fights it off. Okay, so now I'm going to be talking about the key takeaways that you should get from the video. So coronavirus disease is an infectious disease that is caused by the SARS virus that causes people to be ill. Some symptoms may be fever, coughing, loss of taste or smell, and sore throat. But some people may be asymptomatic, so be careful of your surroundings. So make sure to cover your coughs and sneezes, perform proper hand washing, and keep your unwashed hands away from your face. So get tested if you're experiencing any symptoms or if you've been exposed to any known or suspected contact to the virus. Make sure to physical and social distance. Quarantine if you have it for approximately 2 weeks. Make sure to get vaccinations. This helps decrease the chances of catching COVID. And the use of face masks or covering have been recommended in public settings to minimize the risk of transmissions. Thank you, Sarah and Mom. Take care.
Thank you, Sarah and your mom. Take care.
Thank you, Sarah and Mom, for listening. Hope you've learned a lot today.
Thank you, guys.